Good afternoon, everyone. Thank you for joining us for our weekly COVID-19 community update. I'm joined this afternoon by Monroe County Public Health Commissioner, Dr.
Recording in progress.
Mendoza. This is a big week across our community. So before we get started, I want to give a big congratulations to all of our students, teachers, and school staff who started the school this week. I'm wishing all of you a healthy and happy school year. And it's really just exciting to see all of our kids heading back to school. So good luck to all our students. Good luck to our teachers and faculty. We wish you nothing but the best in this upcoming school year. So now on to this week's update. First, to check in on our numbers, we'll be reporting today 169 new COVID cases, which brings our 7-day average of new cases to 142. Last week on this day, on Thursday, we reported 192 new cases with a 7-day average of 170. So at this point, it would appear that our numbers have plateaued, but we also are in an uncertain time, as you know, with our numbers heading up and down with pretty dramatic shifts, particularly because of the holidays over the last couple of days. Our area is still designated as high COVID transmission, according to the CDC, and we need to continue to act accordingly, and also to give this a few more days to really see what the impact of the holiday was before we can really characterize whether or not we've plateaued or started to head down. On the vaccine front, there are over 453,000 Monroe County residents who have completed their vaccine series, and over 485,000 who have had at least one dose. That represents over 75% of our eligible residents who have received at least one dose of the COVID vaccine. As we've said all along and will continue to say today, vaccination remains the best and most effective tool our community has to combat COVID-19. It's free, it's safe, and it works. If you're eligible and you haven't been vaccinated yet, today is a great day to do so. In addition to continuing our partnership with the Finger Lakes Regional Vaccine Hub, Common Ground Health, and the City of Rochester, to ensure residents across our community have access to first and second doses of the vaccine in our smaller, community-based vaccine clinics, this week, my team has also started to plan for the upcoming administration of booster shots. We've all heard the news from President Biden regarding his goal to have COVID-19 boosters authorized by September 20th. And while we're waiting to learn the final details of what will be approved by the FDA, my job is to ensure Monroe County is ready to provide those additional vaccine doses to our residents. So how are we preparing? We've worked very closely with the data analytics team at the Hub to look at who may become eligible for the third vaccine dose, when they would become eligible, as well as the total number of third doses we may need to administer. What we're looking at is a surge of residents who will become eligible for a third dose beginning at the beginning of October, with a growing number of residents who will continue to become eligible for a booster peaking sometime at the beginning of 2022. In our models, we're able to see the tens of thousands of residents who will become eligible for the third dose or the booster shot on a weekly basis from November, December, and into January. And we can really look week to week at how many people are eligible for the booster shot based on how many received it earlier this year. The reality, though, of those numbers means that our current vaccine operations, whether they're the county-run clinics, pharmacies, healthcare settings, or others, will not be able to handle the volume that we're going to be looking at. Because if you look back to when we first started administering vaccine, our community had the Dome Arena, the Hawkeye site, and the Convention Center, all vaccinating thousands and thousands of people per week. We don't have those sites anymore. And that means Monroe County will need to reopen and reestablish mass vaccination sites for our residents. Right now, we're in the process of evaluating locations, and we'll be making announcements regarding those soon to make sure that the vaccine is easily accessible and convenient for our residents. But for today, our biggest need is staff. Our goal is to continue our neighborhood-based clinics, as well as to operate these additional mass vaccination sites. Therefore, we need to hire at least an additional 100 staff members by the first week of October. These positions include our COVID RNs who administer the vaccine in our clinics, EMTs who monitor our observation areas in our clinics, and COVID clerks who provide administrative support to our clinics. All these positions offer flexible schedules, both in terms of the number of days and number of hours, and offer competitive pay ranging from $17.50 to over $28 an hour, depending on the job. Additional information and applications for all 3 positions can be found on our website at www.monroecounty.gov. So this is my call to action today to our community. Do you have a few hours in your week to dedicate to our ongoing fight against COVID-19? If the answer is yes, now is the time to raise your hand once again, as we have as a community over the last year and a half, to support our efforts. And today, those efforts are around the administration of vaccine. So with that, it's my pleasure to introduce our Public Health Commissioner, Dr. Michael Mendoza.
Thank you, County Executive. I want to echo the sentiments that the County Executive shared with us just now, which is first a word of warm appreciation and thanks to all of the students, the faculty, and the staff of our schools, private, public, charter schools alike, across our county, who have been working feverishly for the last 3 months especially, but for the last 20 months to get us to the date that we are here today. Today, and over the last week, for the first time in 18 months, our children are now in school full-time. Make no mistake, this is a huge collective community-wide accomplishment. That being said, we can all agree that our schools are not entirely normal quite yet. Our school is masked. We are worried about vaccines. We are thinking about what the uncertainty brings for the next several months. But I think it's prudent today to pause and reflect at all that we've been through and all of the things that we have done to collectively get us to where we are today. 1 year ago, we were not sure that we were going to be going to school, and we were definitely not sure what that school would look like. Right now, as we look ahead to a fall of classes and athletics, we have a much greater sense of how things will look, and we have a much better idea of what we need to do to keep us here where we are today. That being said, today is not a normal day for school. Our children have not been in school like this for a long time. I've said many times before, and I will say it again, it will take decades for us to fully understand and unpack the trauma that has happened in the last 18 months, in particular for our children in our schools. There is a lot that is unknown. And so I want to encourage all of our parents out there today to check in with our loved ones, our children, when they get home from school today, to ask them about how things are going. The curriculum is important, classes are important, but our mental health is especially important. We need to give our students and our children and our parents and teachers and staff that space and time to heal, because this process will take certainly many, many more years to fully understand. Now, a few words about the booster. You've heard about the booster. It is not yet fully FDA approved, and we don't yet know the details about the booster, but make no mistake, we are preparing for it because we believe the day of having boosters here in Monroe County, as well as across the country, is drawing near. It is still important, even though many of us are thinking about how we get our booster, the most important public health intervention is to ensure that those who have not yet gotten any dose get there first. Because from a public health standpoint, we don't yet achieve herd immunity until we have the vast majority of our population having gotten at least 1 dose. So our work in the communities where our numbers are still somewhat struggling is still especially important, if not more important now than it ever was before. So with that, I will pause and turn it back over to our county executive, and we'll take your questions.
Okay. Great, thank you. Thank you, Dr. Mendoza. And Dr. Mendoza and I can take any questions from members of the media.
First up, we have, this is Tanner with the county. First up, we have Jennifer Lukey with News 10 NBC. 1 question and 1 follow-up.
Great. Good afternoon, guys. I have a question for Dr. Mendoza. Obviously, we know the state's reopening guidelines for schools indicate that anyone who is not vaccinated, teachers and staff, should be tested weekly. It's our understanding you have advised schools to have a plan in place for that by early October. How and sort of what is the undertaking there? How will you get enough testing supplies? I know the guidance also indicates that students who want to be tested should be tested weekly. Where is that testing material coming from? How is this going to be rolled out, and what do you expect to see?
Great, thanks for your question, Jennifer. So we're dealing with 2 separate issues. First, we have the teachers who will be required to have a test unless they're able to opt out with proof of their vaccine. So we're anticipating a number of teachers in all of the districts who have not yet gotten their vaccine who will be tested. And we also anticipate that a number of teachers who have gotten their vaccine will also elect to be tested as well. I've advised the superintendents that we want to welcome anybody who wants to get tested to have the test, and we're going to offer it at each of the schools. Over the last several weeks, we've been obtaining test kits from the state and from various sources. And my anticipation is that we have more than enough test kits to go around for the teachers and for the students, which we'll get into next, for at least the next 6 to 8 weeks. Now, when we look at the students, the guidance came out last Thursday indicating that schools must offer testing to all unvaccinated students, which would be all students age 11 and younger, and the select few students in the higher grades who have not yet gotten the vaccine. We also anticipate that there are going to be many parents of children who are vaccinated who will want to get their child tested as well. And so we want to be able to provide for that testing as well. We're going to do that in the schools. And again, we have ample supply to take care of all of them. The most important point, particularly speaking about the students, is that we will not test anybody who does not have parental consent. I want to be very clear about that. We do not do medical tests on people who in whom we don't have the appropriate permission. So that process is going to take some time, and that's the reason in negotiations with the school superintendents and with my department that we weren't going to be able to implement this, quote, effective immediately, which is what the guidance had said last Thursday. So we want to give our school superintendents that time to reach out to their parents, to reach out to their teachers, to get the appropriate permissions and so forth lined up. And our hope is that by October 1st, and some schools may do it before then, but by October 1st or October 4th, thereabouts, that we'll be fully able to implement this testing program.
Jennifer, do you
And
have
then
a follow-up?
I have, I just have one follow-up for the county executive. County Executive Bello, last week I asked you about this vaccine mandate for healthcare workers, and you seem to indicate that we were not in Monroe County in as big of a potential crisis as some of our surrounding counties. You specifically mentioned the nursing home in Monroe County, but I think I was sort of talking about it on a bigger, wider scale. A lot of the counties surrounding us have said that they feel like there will be a crisis with staffing because of this mandate. The governor yesterday seemed to indicate she's worried about it as well. I also wonder if those folks in those surrounding counties will then look to Monroe County and put added stress and pressure on our health systems in looking for care. What is the latest with your conversations with our health systems as far as what percentages they're looking at of employees who are not willing to get the vaccine, and how that is going to be handled in 2 weeks?
Sure. So here's what those conversations look like. And, what I said last week wasn't that there's no concern for it, but it was looking at where the numbers were and the fact that you still have 3 weeks to go. There wasn't a crisis point last week, but make no mistake. I mean, healthcare has been needing more staff. We've needed more people entering the field of healthcare in this community for a very long time. There's been shortages for years, particularly as you're looking at how nursing homes are staffed. What I was responding to is how will the mandate of the vaccine impact those staffing levels? And I'll start by saying this: the vast majority of people working in healthcare in our community have been vaccinated. And I even look at the one healthcare institution I have responsibility over at Monroe Community Hospital. The number is around 80% of the staff there had been vaccinated as of a week ago. And so we thank those healthcare workers. They've been at the forefront of COVID, fighting COVID-19 from the beginning, and they're leading the way yet again. The issue is that there's still a couple weeks left. Are we concerned? Of course, there's always a concern as to what's going to happen, what comes next, and to make sure that those staffing levels remain where they need to be so we can keep beds open and make sure that our hospitals aren't overly stressed. So what's going to have to happen is over the next couple of weeks, this is going to have to be monitored. And we'll monitor what those levels are and where it could trip hospitals facing having to close beds or things like that, or shifting staff around. So this is something we're going to have to keep monitoring over the next couple of weeks in our community. I check in with Monroe Community Hospital every day, and I think that we're in good shape there. But we're going to have to continue to monitor this with our hospitals to see where we are. And the governor, to her credit yesterday, also acknowledged that they're monitoring this. And so we're going to have to do that in partnership and see where we land in a couple weeks.
Thank you, Jennifer. Do we have a reporter with WROC on? Anybody with ROC? All right, we're going to move on to Patty Singer with Minority Reporter.
Hi, thank you. Last year, when there was in-person learning, it was a couple days a week that, half the class went one time, half another time. So we haven't had full buildings with COVID. So what is being done to assure, whether it's, testing air quality or whatever, or being certain that we're not going to have the problems we see elsewhere in the country with schools now that the buildings are full and we're already going into the school year with numbers rising?
Mm-hmm. So a couple of things. First of all, that's why schools it's critical that schools maintain mitigation efforts that they are using inside their buildings. And they've been working very closely with our Department of Health, and I want to thank them for that. This is not easy. But the children right now, as well as adults in the school buildings, are required to wear masks. That's something that we know works. It worked last year when schools were in session and in person to help mitigate any spread inside the buildings. And I have confidence that those will work again this year as well. There's also efforts being made physically distance as much as possible in the schools. And then also, obviously, around lunchtime and other times where it's difficult to keep a mask on and remain distanced, there are protocols in place to make sure children are either cohorted or other things like that. So when you combine those mitigation strategies along with the surveillance testing, and the testing capabilities that the schools are going to have here, I'm confident in our schools reopening and doing so in person. I think that again, the consequence of keeping our children out of school for another school year and doing this hybrid model, the consequence there is too deep when we know so much about the virus. The other thing that we have in our tool belt this year that we didn't have last year is the vaccine. And I can't underscore this enough, and even going back to Jennifer's last question, the one unfortunate thing about the conversation and debate around mandates is we don't want to also get lost in that the real conversation needs to be about the efficacy of the vaccine. The vaccine works. Let's focus on that. Let's focus on making sure that we educate this community on how well that the vaccine does work, and that it keeps you from having a severe course of disease. The vast majority of the people who are hospitalized in ICU in our community are coming from the minority that are unvaccinated. And so we've got to get the vaccine out into the arms, into the community, but that's how we can also keep schools safe. So when you have eligible students who are eligible for the vaccine, they get vaccinated. We have faculty and staff encourage them to be vaccinated as well. That helps to stop the spread, helps keep us healthier, and helps keep us out of the hospitals and ICUs.
So just to follow up with that, with the air quality question, there's a sense, we go into the fall and the winter and just colds and things like that because of, bad air quality and things along those lines. What's being done, I guess, from the health department sense of, testing air quality, paying attention more to that, air exchange than we have done in the past that would help with COVID and also maybe help with other airborne respiratory infections?
Sure, I'll have Dr. Mendoza can address that.
Good afternoon, Patty. Air quality is certainly very important. We know that COVID-19 is a respiratory transmitted illness, and so air quality matters more than anything else. The schools have been given guidelines from OSHA as to the particulars of the air filtration that needs to be in place in their school buildings. But the most important line of defense is literally the mask. So even with all of the air quality improvements that have been put into place, the mask is clearly the most important of them. Testing air quality isn't really applicable in this setting. There are no assays of air quality that will tell us about the predilection toward having COVID transmission. We do know that more air exchanges per unit of time, per minute or per hour, the better, the more the better. But there really isn't very good science because there are still so many other variables beyond air exchange frequency, like the size of the room, the location and the placement of windows, how windy it is outside, whether it's sunny or not. And there's a whole host of variables that we just can't control for. And so testing for air quality would only give us one data point among many. The most important data point that we have is that the vaccine is here and it's working for those who've gotten it, and that for everybody, no matter what, the mask is truly the last line of defense.
Thank you.
All right, thank you, Patty. Next up, we have Natalie with 13 WHAM.
Hello, everyone. I have a question for Dr. Mendoza. Addressing the COVID cases found in children, we understand that nationwide, this has been a record-setting week for cases in kids, upwards of 25 to 27% found. Where do we stand in Monroe County, and what are the concerns locally heading into the school year?
Well, we've always said that cases matter because cases can be a predictor of hospitalizations and other consequences down the line. When we see more cases in kids, there is still a health concern. We certainly know that there are children who are hospitalized and have long COVID and other syndromes following, but thankfully it's not as severe. So we always want to take what precautions we can to prevent illness in children. But the reality that we have right now is that the rising case numbers really mostly threaten our ability to keep our schools open. And what we're seeing in the contact tracing over the last week to 2 weeks is a number of things. In-home or personal gatherings, social gatherings in our homes remain far and away the most common explanation for transmission. Where does it come from? If it originates in the child, usually unvaccinated because they're 11 or younger, the story is that they were traveling to another part of the country. They had gone to camp. Weddings and other family events were very common in the last several weeks. And so we're going to be seeing the after effects, if you will, of those events probably for another week. So it wouldn't be surprising to me if our numbers did not go down, as we are all hoping that they will. But as long as we can find an explanation for these cases, which is why it's such an important message that we ask our public to collaborate with us when we do our contact tracing, because if we're not able to find the source, then I will start raising the flag, wondering about whether we have more widespread transmission. So just seeing more numbers, though concerning, if we can tell a good story as to why those numbers are increasing, is far more reassuring. But I think for right now, we've got to just look back and realize that a lot of these end of summer events are what are causing the numbers today. And so anything we can do to buckle down to try to keep our schools open is really in everybody's best interest.
Thank you for that. And I just had a follow-up question for the county executive. This one surrounding the mass vaccination sites that you had addressed in the beginning, Adam. So while the county is evaluating locations, can we expect that these sites will go to the places that they were originally? And then my back end of that question is, are you confident that the staff you're looking for can be hired in time?
Yeah, so I am confident because we did it once before. So the good news is that, and I'll put it this way, the good news is that we have a roadmap. We've done this before. So last December, when we saw the vaccine supply start to increase, we understood that these mass sites were going to be needed. We started putting together the mass vaccination site that the county controlled at the convention center. Obviously, the state had the dome, and then there's a state and federal partnership at Hawkeye. So we have that roadmap. We know exactly what we need to do. We've never set one up before a year ago. Now we have. So what we're looking to do, that's why we know exactly how many people we need. We have all the job titles. We know exactly where we need to place people. And it's a range of people that we're looking for right now. It's not just RNs and people who could administer doses of vaccine. We also need clerks. We need EMTs. We need a whole range of different folks with different backgrounds and skill sets. So the team is going to work very hard over the next 3 weeks. It's about the time we had last time to set up the convention center. But I also would say this is a bigger effort. And that's why we need the community's help. And I did a call to action today to the community to come forward. If you're looking for work, we'd love to have you. This is going to be a Herculean effort. The number of doses of vaccine that we administered earlier this year was done over a much longer period of time. What we're looking at right now is because it's compressed, because there are people who are already beyond their 8 months, right, when they receive their second dose. earlier this year. So you're going to have that compression issue that we're going to have to deal with. So we know through our modeling that it's going to be around the first week of October is where we're going to see that initial first wave occur, where we're going to have to step up these mass vaccination efforts. And then we know that that'll stay relatively steady till right about Thanksgiving. And once we get to around Thanksgiving week through Christmas, we're going to have an awful lot of people looking for those third doses, and we want to make sure we're in a position to administer those. The second thing that's happening at the same time is that the state was also very clear that they want to be in the position to help localities set up these vaccination sites if they need help. So that's why we're also starting now. We know the big surge is going to come around Thanksgiving, but the initial one is here in early October. So we need to put our sites together so we understand what we're looking for from our community partners and the gaps in the system that they can fill. So it's critically important that we step up right now, do everything we can, even before it's authorized. We don't know for sure what the authorization date will be, but we know there will be a third dose or a booster shot that's authorized here at some point. So we need to be in a position to be ready for that. And I'm confident that we can be.
All right, thank you, Natalie. Next up, we have Lowell with Spectrum News.
Hi, this question is for County Exec Bello. Question is COVID related, but indirectly, and I have a few parts, so pardon me. But I know the president is expected to sign an executive order mandating the COVID vaccine and without testing. Given that, I know the state has generally followed suit behind the president. And given that what we're seeing at our healthcare facilities about some resistance, although a good majority have been vaccinated, are there any plans if people lose their jobs because of this? Are there any plans to maybe help them find jobs? Have you all thought that far yet?
Well, here's the problem. So one of the frustrating pieces of the whole debate around mandates, and to be clear, Monroe County has not mandated vaccine for our employees and has not done that yet, is that it takes away from the real message and the real conversation that we have to have, and that's around how important it is to get the vaccine. There are a lot of people in our community who are still vaccine hesitant. There's obviously going to be a portion of the population in our community who is going to say, no, I'm not going to take this vaccine no matter what. But there's still quite a few people who are looking to have questions answered. And so we need to spend the time right now, not debating mandates, but really working and putting our resources into helping people answer those questions and understand why it's beneficial to have the vaccine. And why, frankly, when we get, as Dr. Mendoza said too, as we get to those conversations around herd immunity, and we have enough people in our community who are vaccinated, we can get through this pandemic out to the other side. What does that look like? The only way to get there so that you don't have to have these conversations around mandates with the vaccine or masks is to get as much of the population vaccinated as possible.
One quick question. Given that we're going into this booster, the third dose for the vaccine,
Yep.
Will that effort be tough to get people their third dose, but also getting people their first dose?
Yes.
And my second question is, given the crisis that's happening with the school bus drivers in the city, is there any way the county can step in to help or offer some type of aid?
Yeah, no, thank you for asking that. And you hit the nail on the head there. So that's why this call to action was important today as we build up our mass vaccination sites, because it is important that we continue the efforts that we've been making to reach people and continue to offer the first doses and the second doses that we've been doing to the community. So as we set up mass vaccination sites, it's so critically important that those don't take the place of the current efforts that are undertaken with the first and second. We have to be able to walk and chew gum at the same time. So we have to be able to bring on additional staff, build out the capacity, not replace it, but build it out so it's bigger, so that we can manage both. And I'm confident in our ability to do both because I'm confident in the community. We've had, like I said, over 70% of the community has been vaccinated who are eligible to do so. So the vast majority of our community has stepped forward. They've been vaccinated and they're doing their part to put an end to the pandemic. As far as the bus situation goes with RCSD, I've offered the full support of the county. I've had several conversations with RTS over the weekend with the state education commissioner and the board of regents, because and offered whatever support we can to help those bus drivers and will particularly help those children get to school. In my view, it is critically important. We talk about it always in context of the vaccine and the pandemic, but globally, it's critically important our children go to school. They were away from school for far too long, and in-person learning is better for their educational success, but it's also better for their emotional and psychological and social impacts as well. Schools provide an awful lot of resources to our families just beyond the education that our children are receiving. And so it's critically important this community come together and do everything we can to make sure our kids can be in school. And I want to thank Bill Carpenter and the team at RGRTA for working over the weekend. They worked very long hours over their holiday weekend to redirect bus routes and buses to make sure that our kids can get to school. And I want to thank them on behalf of this community. And really, I think our whole community owes them a debt of gratitude.
Okay, lastly, we have Alex with WXXI. Alex, are you with us?
Okay. Did you want to say anything else? All right. So thank you all again for joining us this week, and appreciate you helping us get this message out. And remember, the most critical thing this community can do over the next several weeks as we get into the school year and as we get closer to those winter months is to be vaccinated. So thank you so much. Please go to our website at monroecounty.gov to learn more about those job opportunities to work in our clinics. Thank you.